Hi, my name is Yashpal Rathore. I'm 59 years old and I had come to Dr. Abhijit sir for a chest related problem. In fact, my left LAD is 100% blocked. Luckily for me was that the rest of the heart functioning was alright. The ejection factor also was not very good. It was about 30. And I used to feel weakness, and also there was a lack of stamina a lot of times, and I used to feel dizzy. And maybe it could be due to my blood pressure problem, little bit of cholesterol. So looking into that, I came to Dr. Saab and I spoke to him. And he had advised me actually EECP. At first, I think people are not very well aware of it. I had done an extensive study on this, and mostly whenever they find some blockages or some kind of blood clot in the heart, the doctors advise them to go for a surgery. And in my case anyway, that was not applicable because the left LAD was totally blocked, 100%. In fact, it was dead. So in my case, it was only due to medication, to follow a proper lifestyle. And I was also told by Dr. Saab that you have to do a little bit of exercise on a daily basis. You have to follow a very strict regime where you have to follow a strict diet as well. So based on that, I came here for 35 days of EECP under doctor's guidance, and today after 35 days I'm sitting here in front of you. I would like you to assure you that I'm feeling very strong, I'm feeling much better, and also I'm feeling quite energetic actually. In fact, I would also recommend you to go for this on a it is my sincere advice that instead of going for surgeries and all, EECP is a good option. But yes, we have to follow a very strict regime. Also at the same time, I would like to recommend and tell you that my wife, her name is Pushpa Rathore, and she is 57-year-old. She is a diabetic. She has hyper blood pressure, and she was complaining of chest pain. She was complaining even while walking. She used to feel exhausted. She used to complain that she cannot walk, she cannot, and then it was really worrying for us. So we went to the doctor at Bhaktivedanta Hospital. There the doctors advised her to go angioplasty, and after that the reports came in and they said there is a blockage of 90%, 90% and 75% in all the three major arteries, and you will have to go for a bypass. Now that really set the entire world on fire for us. I was so worried. And see, this is what happens with most of the patients. The minute the doctor finds out the findings, which it's based on a trust, and of course the reports are in front of you, and the doctor tells you, okay, you have to do a bypass, you have to take a shunt, or you have to all that on surgery. But in my case, in my wife's case, we were a little worried because she's a diabetic. She's also having a blood pressure problem, and after the surgery, the recovery period, see, I thought it in that manner, and we said, okay, we'll go for a second opinion, a third opinion. We went for 4-5 doctors, and ultimately we came to Dr. Abhijit Akulkar clinic here, and he told me, Rathore, why don't you tell your wife to go EECP? So my immediate question was, sir, but how we are going to clear the arteries? Then he explained us the entire process. See, EECP is basically nothing to do with the blocked arteries. It has to also do with your overall health of the heart. And that's where we got the confidence. He also mentioned that after doing ECCP for 35 days, there will be capillaries developed. Collaterals will be formed in the arteries, which will take over the function of the arteries which are already blocked. So once it is like a natural bypass, and that really gave us confidence. And I also gave a second thought, okay, since my wife is diabetic and the recovery period could go for a very long time and it could have further complications. So we said, okay, let's go for this. And then for my wife also, we went ahead. In fact, both of us, we went through this process, and today my wife is really feeling good. Whatever she used to complain about the chest pains, whatever she was complaining about exhaustion while walking, now she can. In fact, we are going to the Joggers Park every day at Mira Road. We are residents of Mira Road, and I would proudly tell everybody that today, every evening religiously, we go to the Joggers Park and we do brisk walking for 6-7 rounds of that Joggers Park. Now Joggers Park, let me give you an idea. At least for 1 hour, we do brisk walking, and she's feeling absolutely all right. Again, the secret lies in your diet, your lifestyle. You need to take proper food, which the doctors and the clinic, in fact, I would mention here the entire clinic staff. They were so helpful. They gave us entire this thing about the diets, which we are following very strictly. In fact, where the secret lies, after a certain age, we should cut down on certain kind of red meats, certain kind of non-vegetarian food, and your drinks habits, your partying habits. See, if you are having a disciplined life, your heart will remain healthy. And that's what we are feeling today. The minute we have started following a particular kind of regime directed by Cordis Clinic and the doctors here, it has really helped us. I would really like you people not to follow a sheep mentality where the doctors advise you to go for a surgery. I think EECP is a very good option. We must always try for that and leave the surgery as a last resort. With that, I would like to really thank the entire people here at Dr. 𝐂𝐨𝐧𝐬𝐿's clinic. Big thank you, sir. And I'm sure I would also recommend this kind of treatment to the people who are undergoing what we had undergone throughout. With this, I would thank you once again.